As you can tell, this meeting is being recorded. I would like to let you all know that you are being recorded. If you want to change your names, please do so now so that you're not kind of seen. For most people, your microphone and cameras will be off. It just minimizes the amount of stuff my brain has to deal with. This is like a question and answer session, so please do feel free to make use of the chat function. You should have a box at the bottom of your screen if you're on computer for chat, and if you click on that, you can pop your questions in the side. For those of you who haven't been to one of these before, my name is Jo Southall. I am an independent occupational therapist. I also live with hypermobile EDS, POTS, all kinds of other weird and wonderful medical thingies. So this is kind of a combination of my personal experience as well as my professional experience working with hypermobile people. So I am quite happy to answer questions on pretty much any symptom. We can talk about management strategies. We can talk about general understanding and knowledge of the conditions. So please just let me know what you would like me to talk about and I will talk about it. I'm very aware this is quite jiggly as I move. I'm just going to shove my desk over to the side, sorry. Hopefully that'll keep the screen a little bit stiller. Lovely. So I have 4 pre-asked questions today, which I'm going to make a start with, and then I will jump into any that have popped up in the chat in the meantime. So the first question from somebody who has just returned to work after a year off with COVID, plus complications from existing stuff. Purchased a sit-to-stand desk from to work from at home, and access to work and not responding to emails, which is frustrating. Hopefully they'll get back to you soon. Seems like all the equipment needs are pretty much sorted. I'd like advice on finger splints for hypermobile EDS. Lovely. So splinting in general, what I would encourage is something called activity splinting. So rather than looking at a body part like a hand and going, this bit of me is hypermobile, so I need a splint all the time, we would instead look at this bit of me is hypermobile and it impacts my ability to do insert activity here. So I might need a splint for this activity. Generally speaking, with any kind of splinting, the more you splint, the more you brace, the less work your body actually has to do to protect itself. So there is a concern around something called deconditioning, which is basically just your body getting lazy because the splint is doing all the work for you. Now, I think the vast majority of healthcare professionals are overcautious about deconditioning as a reason to not splint. Personally, I think splinting, if used appropriately, can be really beneficial. So what we're looking to do is to stop that constant cycle of injury, rehab, injury, rehab, injury, rehab. So what you can find is that if you're injured regularly, you end up in a 2 steps forward, 2 steps back kind of thing. And you can't actually make any progress because your body is so exhausted and broken and damaged and inflamed, and you're in so much pain that you really just rehab is not really something that happens. So with splinting, what we can do is stop that constant cycle of injuries and damage so that your pain calms the heck down, so that your body starts to repair some of that damage, so that you can then do a bit of rehab, build some muscle, and prevent these things in the future. One of the difficulties with hands in particular is that there are an awful lot of very small bones in your hands and wrists, and there is not a massive amount of muscle to support those joints. The other issue is that we use our hands basically constantly. So it's very, very difficult to rest hand injuries for the appropriate amount of time that we would encourage you to rest a sprain or a dislocation for. So hand splinting is one of those areas where maybe we push that a little bit and we maybe splint slightly more proactively, simply because the incidence of injuries tends to be really high and the ability to rest tends to be really low. So for things like typing and writing, something like ring splints can be really, really effective. So what a lot of people will find is that when they write, they get that as a pen grip. Sorry, there we go. So you get a lot of hyperextension at this joint in your finger, or you might get hyperextension here, or you might get it in both, or you might get that kind of lockout, awkward subluxy thumb thing. A lot of those can be managed with ring splints. So what we're looking at are splints that look a little something, excuse me, like this. So with these, what we're looking to do is basically block hyperextension, but still allow full range of normal motion. So that allows you to use your hands normally, but prevents you from pushing into those hyperextension positions, which can drastically reduce injury frequency and allow for better recovery. And it also means that it's safe for doing everyday activities that are highly dangerous, like typing or using light switches or push button toilet flushes. They're another one. So ring splints can be a super useful thing for that. Ring splints, you are unlikely to get off the NHS. It's not impossible, but it's unlikely. If you get a referral to hand therapy, they will likely provide something called overlays, which are similar to that, but made of thermoplastic. They come exclusively in beige. I have two issues with those. The first is that I don't know what kind of magic is built into them, but whatever surface you drop them on, they immediately become invisible. And the only way to find them is to stand on them while looking for them, which then breaks the splint. My second issue with them is that if you're very hypermobile, but also very strong, you can hyperextend through. You basically just bend the plastic slightly. So silver ring splints tend to be what I would recommend. Firstly, because they look much nicer, which means you're more likely to wear them and feel more confident wearing them. Secondly, silver makes a noise when it hits like surfaces. So if you drop them or they fall off, you're more likely to notice. And thirdly, because it's an awful lot stronger. So you're not going to be able to hyperextend through and push against the splint using those. I would still have a think about which activities in particular are causing a problem. So you don't necessarily need to be in splints all of the time. Sometimes you will need them for key activities. As an example, I have one ring splint for the tip of my little finger. I only wear it for knitting. And what I found is that when I was knitting, whenever I get to like the bit where the stitches are bunched up on the needle and I push the stitches further down the needle that I'm knitting onto, I would like tweak the little bit of my finger here. And I was getting tendonitis in my little finger constantly. Wearing a ring splint to knit means that that doesn't happen anymore. So I can continue building strength through arts and crafts. So have a think about what activities are causing a particular problem. And then think about the bits of your hands that are prone to the damage because of that. So I would say to focus on your pinch grip first. So your index fingers and your thumbs. This grip is probably the most important in terms of hand function in general. After that, then you have a think about which bits are most injured or most prone to injury or cause you the most pain or are most unstable. Don't feel like you have to buy a full set of splints to start with. Maybe have a think about, just trying one or two. And if they work well, then have a look at other ones and go from there. But yeah, ring splints by Zomil is my go-to brand, but obviously others are available. Perhaps surprisingly, Etsy has a really amazing range of ring splints on it. So maybe have a little look there, see if that's any help. Yeah, lovely. Okay. My second question. I have joint hypermobility syndrome. Was told to do PT. Should I go to regular PT or should I go to OT? Why not both? So I'll start with a little bit of for anyone who's not familiar with those terms, physiotherapy looks at basically the function in your body. It looks specifically at managing injuries, at getting your body doing the job it's supposed to do. So that might be through strength building or otherwise conditioning, working on your range of motion, understanding your posture, using the correct muscle groups for movement, all that kind of thing. Occupational therapists work in a lot of different ways, but we basically have a look at specific tasks or activities that you're finding difficult. Sometimes it will be about modifying how you do it. Other times it will be about modifying the activity. And sometimes it will be about giving you strategies to adapt to the fact that your body can't really handle that task at present. Those two professions often work very, very well together. So as an example, if your mobility is a bit pants and you get tired easily and you fall over a lot and you're injured constantly, you might see a physiotherapist to start the process of building your strength up, getting stronger, stabilizing those joints, gradually improving your mobility. In the meantime, you still need to be able to go places and do things. So an occupational therapist might go, okay, let's have a look at different seats for postural support. Let's have a look at mobility aids, and let's have a look at ways that we can modify your workplace to better meet your needs. So, that kind of approach. I'm a big fan of having multiple approaches going on at once. So I have a regular physiotherapy routine. I do physiotherapy 3 times a week minimum. Not for very long, just a little bit here or there, 3 times a week, just to keep me consistently functional. What I will then do is manage all of those symptoms that are kind of at a chronic level. And when I have an acute injury, or I lose a bit of function, or I'm struggling with a key task, I will then look at specifically treating that one issue. So I'm seeing a physiotherapist on Monday for a hip and pelvic issue. But that doesn't mean I'm going to stop doing my ankle exercises, and it doesn't mean I'm going to stop doing all the things I normally do for pain management. That's just a little extra top up to get me back to baseline, back to being functional, and then I can stop doing those exercises or taper them down to like a maintenance level. Most people who are severely hypermobile will have physiotherapy regularly throughout their lives. Sometimes that's having a routine that you do at home in your own time. Sometimes that's going to outpatient clinics. Sometimes that's having a physio come to you. But doing that in some capacity is probably going to be a big part of managing joint problems. So yeah, probably seeing physiotherapist would be a good thing. Occupational therapy also, obviously it's my profession, so I'm a little bit biased, but things like fatigue management strategies, pain management strategies, tools, gadgets, gizmos, mobility aids, all that kind of stuff can be done as well. And the aim is to either improve your function or to cope with the fact that your function isn't quite where it's at to ideally do whatever task you want to do. So I hope that makes a little bit of sense. But yeah, generally, if you have the option to see both, I would do both. But feel free to prioritize one over the other, depending on what you need right now, who's available and what they can offer in terms of support. So I hope that sort of helps a little bit. But yeah, generally for hypermobility type conditions, what I would say is, we're not all going to have the same team of people involved in our care. And part of that good management strategy is about finding who you need at any given moment. So I saw a lot of rheumatologists in my teens and early 20s. 33 now. I haven't seen a rheumatologist in 8 years, maybe. I don't need them anymore. They don't form part of my current clinical needs. Whereas physiotherapy, I didn't see for a really long time. I carried on with a home-based routine, and now I'm going to again. So yeah, it's dip in and out of whichever services you need to support your life at any point. Get what you need when you need it, basically. And don't feel like you have to see certain people at certain times just because that's what's commonly done. But yeah, I hope that helps a little bit. Thank you in advance. How well is orthostatic intolerance, PEM, chronic hypovolemia, multi-feature illness, etc., understood by people working in health? That is a question and a half. I work in health. I understand all of those things very well, most of them personally as well as professionally. I have met people in the healthcare field who would not know what any of those words mean, let alone know how to manage them or support a patient with those things. It is very, very varied. I think we are gradually seeing some improvement in terms of education in key areas, in terms of general public widespread understanding about things like post-exertional malaise or post-exertional symptom exacerbation. This sounds really awful, but long COVID being a thing has actually been actively helpful for getting like healthcare professionals to understand some of these conditions. I wish it didn't exist, but given that it does, kind of looking on the bright side a little bit. But yeah, I think if you are in specialist settings, as an example, if you're in rheumatology or if you're in a fatigue management setting or if you're in a pain clinic, you are likely to get a fairly good understanding of most of those. If you are in a, generic GP surgery, it will be very, very hit and miss based on that GP and what their patient load has looked like in the past. So You might get a GP who's met 20 people with EDS and POTS. You might get a GP who's never met anyone else with the same conditions as you. So it is very varied. There is absolutely nothing wrong with asking your healthcare team what they know about something. So if I am being referred to a physiotherapy clinic, as an example, I will request that on that referral, it's written that I would like to see somebody with expertise in hypermobility syndromes. So I'm basically kind of insisting that that's something I need on the referral. Likewise, things like, if you're meeting with a new healthcare professional, it's okay to just say, so like, how much do you know about these conditions? Or have you worked with anyone else that has similar things? It's okay for you to ask those things. And I would encourage you to do that, to advocate for yourself and to shop around in terms of finding the right healthcare professional, because there is a huge difference between well-meaning healthcare professionals who don't really know what they're talking about versus somebody who will really understand how potentially dangerous any change to your routine can be and how challenging it can be to make progress with those conditions. So yeah, it's going to be really, really mixed. I currently have 3 students on placement with me. Those 3 students have got a very eye-opening look at what all of these conditions look like. But yeah, it's so varied. There is very little consistency in terms of treatment, unfortunately. So I hope that's sort of useful. But yeah, it does vary a lot. Okay. Any advice for splints available for metatarsal joints? I feel my bones moving so much when walking, and especially on walking and first putting down on the floor. It's like they're dislocating. It's horrible. Yes, it does sound horrible. This settles once I get on supportive lace-up shoes and insoles. Is there such a thing that I could wear through the night? Okay, so feet have very much the same problem that hands do. There are an awful lot of moving parts. There are lots of little bones, lots of little wonky ligaments, and very little in the way of muscle to support all of that function. So it is an area where splinting can be useful, but it is also an area where strength building and like postural alignment can have a big impact. So if you haven't seen one already, I would strongly recommend getting a referral to see a podiatrist. So podiatry can have a look at how your ankles and your feet and your arches and all that stuff are aligned to make sure that when you're walking, you're actually putting weight on the appropriate areas and that those areas are actually kind of capable of supporting your skeleton effectively. A lot of the time, supportive shoes and insoles would be the advice. That's just how it is. But obviously, nobody wants to be in trainers 24/7. What you could do is try, you can often get like really soft shoes that you basically wear for like, yoga or that kind of exercise type stuff. Dance shoes are another example, and put your insoles in them. So you've got something that's a little bit lighter weight, a bit cooler, a bit more flexible that you can just wear around the house. So you're not having to put like your outdoor shoes on the sofa when you've got your feet up, that kind of thing. The other thing that might be useful would be night resting splints. So night resting splints are braces that are designed specifically to wear in bed overnight. They are, generally speaking, very, very bulky, very clunky, very, very well padded. Streamlined is not a word I would associate with them at all. But what they do is basically hold your feet, and they do them for wrists as well and for a few other joints. They hold your feet in a nice neutral position. One of the issues that severely hypermobile people find is that if you're sleeping on your back, as an example, the weight of the duvet pulls your toes down, or like the blanket's being tucked in. And that can lead to you kind of putting pressure on the little bones in your feet and your ankles and popping things out of place. You, generally speaking, would discover that when you attempt to get out of bed to walk to the loo first thing in the morning and fall on the floor because your feet don't work. So night resting splints can be really useful for that because it just gives you a little bit of protection while you're not paying attention to your body because you're asleep. Night resting splints are available via the NHS if you get a referral to see an orthotist. You can also get quite a lot of kind of cheap and cheerful versions off places like Amazon. Generally, I don't recommend buying splints unless it's a last resort. and then ideally do it with consultation with a healthcare professional, simply because some of them can be very expensive. Some of them can be absolutely rubbish, and it's quite difficult sometimes to get the appropriate fit. And if you don't have the right fit for something, you aren't going to be getting the amount of support that you need in the right places. So I would, if at all possible, see an orthotist. A podiatrist might be able to help with night resting boots as well. And they will hopefully just keep your feet in a nice, neutral, safe position so that everything's attached where it's supposed to be attached, and you can start your day with working feet. Even if that ends up not continuing throughout the whole day, it'll at least be a good starting point. So yeah, hopefully that helps a little bit. But yeah, night resting splints would be a thing to look up. Okay. Yep, that is all of my pre-asked questions. So it's on to the chat. Lovely. Okay. I've been suffering from tennis elbow since April. It seems to get better and then get worse, or much worse, when I do this lightest activity. I was given a strap which I cannot use as it causes bruises. I've tried using a sling to keep it immobile, but it also leaves bruises. My body's prone to get bruises even when I'm sleeping. What can I do about the tennis elbow to improve? If you haven't already seen one, please, please, please see a physiotherapist about that. There's like a rest element of recovery, and then there's like a rehabilitative element of recovery. And if you're doing one but not the other, you're never going to get to the point where you're like preventing it from happening again. This may also be the sort of case where actually if you've had like a real instability and a chronic injury for a long time, it may be that you need something extra to really help with your recovery, whether that's therapeutic ultrasound, whether that's infrared treatments, heat, ice, massage. It might be steroid injections, maybe. I don't know. But it does seem like this is just becoming one of those vicious circle things that's just a waste of your time, and you're going to end up keep going round and round, getting more and more pain. So I would definitely recommend seeing a physiotherapist about that. The other thing you could maybe have a look at would be kinesiology tape. So it depends whether your body tolerates like adhesives better than it does compression, by the sounds of it. Kinesiology tape can be a way to restrict that range of motion, but without actually having to have a splint or brace on, which would then cause the bruising that you're talking about. So yeah, I would go back to physiotherapy, or go to physiotherapy if you haven't been before. And whoever gave you the strap, go back to them as well and say you can't use it because it's causing bruising. It may be that the fit is wrong, or it may be that you just need to kind of tweak how and when you're using it as well. So it definitely sounds like that needs looking at by somebody in person, unfortunately. Yeah. Also, that seems like I know most of us bruise fairly easily, but that seems quite extreme. So if that hasn't been investigated yet, maybe put that on the list of things to discuss with a GP. The odd surprise bruise here or there, generally acceptable, but consistently getting bruising from things like being asleep or wearing a sling, I would be a little bit kind of not concerned, but I would want that just checked up on just in case. I think there's a tendency when you've got a long-term condition for everyone to just attribute everything to the long-term condition, like the bruising must be from hypermobility. But actually, there are plenty of other things that can contribute to severe bruising or easy bruising. And it may be that you've got one of those things going on as well. So if it hasn't been investigated thoroughly, I would get that investigated, and definitely go back to the people you've seen before and feedback that what they've given you and what they've recommended has not had any kind of positive impact. But yeah, physio, I think, is definitely going to be the one there. Unfortunately, sorry, that's not like a massively helpful answer, but hopefully it helps a little bit. Is there a solution for bladder incontinence? I was given some exercises, but they were not useful. Nowadays, I leak every time I sit down, stand up, or walk. So actually, there is actually a branch of physiotherapy that deals specifically with things like bladder incontinence, pelvic floor dysfunction type stuff. So specialist physiotherapists might be the way to go. I would imagine part of it is going to be exercise based, but there are some kind of internal devices that you can use to really, really help with pelvic floor muscle building as well. Likewise, most GP surgeries have an incontinence service attached to them. So I would specifically ask about a referral there. That's going to be one of those things where there is an element of let's rehabilitate and let's try to get the incontinence sorted. But in the meantime, here is how we can support you with living your life. Because obviously that's going to be massively inconvenient and not particularly fun to live with. So physiotherapy, like women's health physiotherapy, or, you know, like an incontinence physio would be my suggestion there. And then linking up with your GP's incontinence service as well for support. They might also have things like products you can try in terms of like incontinence pads and things as well. So hopefully that helps a little bit. Okie dokie. Any tips or things to do supporting bandages or other tools that can support in sudden flare-up and instability of joints across the whole body? I usually have one or two, but at the moment, instability across the whole body, and I haven't found a sensible way to deal with this. Honestly, if you're in a full body, completely falling apart flare-up, the best way to deal with that is just to lay down until it gets better. I know that's not particularly helpful, but there are going to be times where if your whole body is rebelling against it, and this is often kind of a hormonal based thing for a lot of people. Obviously, I don't know who you are that sent this question in. So I would guess there might be a progesterone based element to this. Quite a lot of people will find that this happens around menstruation or around like post pregnancy or pre giving birth type stages. Honestly, like if you the risk for situations like this is that you're at really, really high risk of injury. And when you're at really high risk of injury, trying to persevere like there's nothing wrong and just covering yourself in sticky tape and Velcro and hoping for the best generally is not going to be the best way to get you over that and back to being functional. So a little bit of extra rest is probably going to be sensible. Mobility aids are also probably going to be sensible. Delegating tasks will be sensible as well. That said, obviously, we can't just opt out of life. There are going to be things you need to do yourself. In situations like this, the best thing that I can generally recommend would be custom-made compression garments. Now, this doesn't immediately solve your short-term problem, but it will probably solve this for you long-term in terms of if this happens again, particularly if, as I suspect, this is linked to some kind of hormonal cyclical fluctuation type situation. If you are the sort of person that does go through like full body instability flare-ups, I had one recently, very inconvenient. Custom compression garments really are the way to go because what they do is offer you a decent level of support and a huge boost in proprioception and body awareness across your entire body without having to have you wrestle in and out of 20 different splints before you leave the house. It will just be like one or two pieces of clothing. It is a pain in the butt getting fitted for those. Generally speaking, it involves tape measures in places you've never had a tape measure before. Generally speaking, you will also have to wait weeks in between measuring, fitting, refitting, getting the product, finally trying the product. Any kind of repair work, all that sort of stuff will take quite a long time. But it is the best option in terms of holding you together all in one go. So there are 3 companies in the UK that currently do bespoke garments like that. Allard UK, Jobskin, and DM Orthotics. All 3 of those will be available via an NHS orthotist. They also have a network for most of them of private professionals if you did want to go private to get fitted and measured. But they aren't the sort of thing you can just order off the internet. You do have to see an orthotist or an OT or a physio or somebody with appropriate training to get fitted for them so they can be made specifically for your body. So yeah, I think that's generally the way to go. I would recommend speaking to your GP about an orthotics referral and just explain that lycra splinting, lycra suture type things would be the way to go. I have a substitute link ferry this evening. My regularly scheduled link ferry is unavailable. So if I could perhaps get some of those links in the chat, that would be fabulous. So DMO, Jobs Again, and Allard. Yeah, that would be great. Hopefully that's helpful. Let me just scroll up to the top part because there's another question there. Yeah, as a short-term coping strategy, a decent pair of Spanx or compression leggings that are sold for like sport purposes would be a good starting point. Kinesiology tape can also be useful as well. There are 9,000,001 tutorials on how to apply tape to yourself or to have somebody apply it to you on YouTube. Most of the major companies and retailers of that tape will also have a list of tutorials on their websites. So Spanx in the short term, custom compression garments in the long term is probably my advice there. Okay, the other question is about my daughter. She is 17 months old and will most likely be delayed with walking. Her joints seem very bendy and she struggles to stabilize herself when in the walking position. She isn't diagnosed as hypermobile, and I know it's normal for babies to have very unstable joints. I was just wondering if I should do anything to stabilize her or best to just leave it unless she is in pain. Okay, so this is one of those difficult things where pretty much all children at that age are at least a little bit hypermobile. Children are just made of rubber bands, and that's kind of how it works. The difficulty is, at what point do we start thinking maybe this is like hypermobility related and not just childhood bendiness? And that's a very large grey area for most people in healthcare. That said, there is absolutely no reason why you have to have a diagnosis in order to access physiotherapy, in order to access occupational therapy. So getting referred to pediatric OT, as an example, or pediatric physio might be a good way to help with the walking, regardless of what the cause is of that problem. So we're not necessarily looking at slapping a diagnostic label on anything, but if she's having difficulty walking, we can look at ways to improve that. So pediatric physio or OT would be my advice there. If you have a health visitor, speak to them about a referral, or speak to her GP or your whoever else is available, pediatrician, etc. But yeah, I think let's get proactive, get her in a bit of physio, see how it goes. At that age, there's very little in terms of stabilization available other than having bespoke made orthotics. That would genuinely be a last resort type situation after you've tried a lot of physiotherapy. So if you're looking at splinting somebody that tiny, the difficulty is that they grow out of splints as fast as you can make them. So you end up constantly in and out of appointments getting new things made. Whereas physiotherapy will help with the stabilization, building a bit of muscle, building a bit of confidence, looking at her gait patterns, all that kind of stuff. And will probably be really helpful. She may well end up not being bendy at all, and we're all good. But there's no harm in it. And it will probably be sensible to be a little bit proactive in this situation. So I would probably ask about a referral there and see how it goes. I think, yeah. Can I be referred to NHS orthotics for ring splints? I'm in Kent, if that helps. Ring splints, if they're on the NHS at all, would be via hand therapy. I don't know who decided this was the rule, but if you want orthotics for wrists, that's fine. An orthotist can do that, but fingers has to be a hand therapist. But generally speaking, most people end up buying their own ring splints because it's so difficult to get on the NHS. So, yeah, see how that goes. But yes, it's a bit of a postcode lottery as well. So Kent is generally quite good at the whole hypermobility shindig. So if anyone has a chance of getting them on the NHS, I would say Kent is a good place to be. So fingers crossed for you there. Okay. I've been diagnosed with hypermobility about 3 years ago. I haven't had enough information on how to manage it. I have recently had a gastric sleeve in December, and I found that my symptoms are worse with 6 stone less on me. It means that my joints are hyperextending further. I'm not able to take anti-inflammatory medication due to my gastric sleeve. I now realise that my pain is so high now and getting to me down so much. I'm phasing back to work after 3 months off work. I'm a uni lecturer and work on a computer a lot. I am so new at accepting my condition and still scared of wearing supports and using aids. So judgment, but aids through judgment, but it's getting to the point now where I'm losing my fine motor skills due to pain and weakness. Hand resting splints and elbow resting splints from the NHS, full set of finger splints. I would like to know if there's anything else I could use to improve my office/desk setup. I have a vertical mouse and a split keyboard. Okie dokie. Yeah, this is one of those interesting things where I don't have a study or anything that I can cite to say that like fairly dramatic weight loss increases pain. But the difficulty with fairly dramatic weight loss is that it changes how your body moves. And you've probably worked this out yourself, even though nobody bothered to tell you about it, because why would healthcare involve telling you things? But yeah, changes in your center of gravity change which muscles you use to perform everyday activities. Changing in your body shape changes how much pressure is put around your joints and in different places. Being encouraged to exercise, as an example, post gastric sleeve would potentially cause a whole range of different issues. So yeah, any kind of massive change to your body is likely to have a knock-on negative impact on your hypermobility, because hypermobile people do not tolerate change well. And obviously, this is a huge change for you. So I'm really sorry it's been such a painful and presumably exhausting process, but hopefully with the right support in place, it will have been worth it. In terms of your office function and your mobility and things in general, I think using splints can be quite a difficult thing to get used to. Like that change from invisibly disabled to visibly disabled is quite an adjustment for a lot of people. It can also be something that changes maybe how you see yourself, and that's quite an upsetting thing to go through a lot of the time. What I will say is that having splints, braces, and mobility aids that are in the least bit attractive and in line with your personal style can radically change how you feel about using them. So, you know, looking at the ways that you can find things that maybe blend in with what you like to wear, it makes you feel like more of a professional. It makes it feel like you stand out a bit less, and it can be easier to get used to using things in that context. So it might be worth, like, feel free to drop me an email or something if you want to have a chat about that. But yeah, it may be that actually if we can find you something that feels less like different, less othering, less sad, disabled kind of thing, we can get you some really cool looking mobility aids. It may be an easier acceptance kind of to make. In terms of office stuff, I would strongly recommend using a service called Access to Work. It's a bad advert for that when the first question was basically saying that Access to Work don't respond to emails, but I still think it's worth trying. So Access to Work is a government scheme that aims to basically fund disability equipment and adaptations to keep disabled people in work. So what Access to Work can do is provide access to very expensive, fancy equipment that they will basically like part fund with your employer, so you get better stuff without it actually costing anyone anymore. So one of the things that can be really, really useful is to look at seating, particularly in situations where you've had a big change in your body shape and your body function and you're in a lot of pain. Good quality seating with appropriate levels of support and a little bit of adaptation in there in terms of height adjustment, angle adjustment, the ability to recline, height adjustable armrests, all that kind of thing can make a massive difference, particularly for jobs like teaching, working in universities, as an example, where you are, or even like office work in general, really, where you're kind of in the same position for extended periods of time. There is a company called Posturite. If my stand-in link fairy could grab a link for that, Posturite. Posturite make custom seating. And they also have a really wide range of off-the-shelf accessible office options on their website. But one of the things they do is they can send assessors out to come and measure you, look at your office space, have a look at how you're moving around your office space, how you're functioning. And they can advise on things like how you set up your desk and what equipment would be useful. That kind of thing can be like a game changer in terms of basically like promoting function and making sure that you're not getting any of those kind of chronic injuries as a result of being in work. So I definitely think that would be a sensible thing to do. In terms of specific office equipment, there is one gadget that I would like to recommend. So you can get ergonomic armrests that attach to your desk, and they're basically like a 4-arm rest dish on a series of pivots. And what you do is you attach them to your desk, and then you rest your forearms on those like pads. And because of the pivots, you can still move your hands around your desk to type or to use a mouse, but the pad is supporting your arm. So you're no longer having to actually hold your arms up with your own strength, which takes a massive amount of strain off your wrists, your forearms, your upper arms, your shoulders, and your upper back areas. If you take all of that pressure off, you're only using your own muscles to direct movement rather than to actually kind of hang on to stuff and to hold your own body up. So I think they would be a really good thing to find. Link Fairy, there is a brilliant, actually, I'm just going to get this because I think it's going to be hard to find. And I know it will come up on my searches. Hang with me. So these used to be a Posturite thing. And they were super expensive, like 70 quid each or something. But I don't know if the patent ran out or what, but there's now a really nice, totally passable, very usable knockoff on Amazon. So I am just going to copy that and pop it in the chat and have a little look and see if you think this would be useful, because I've recommended these to quite a few people who have a lot of like kind of pain issue type things. There we go. Ooh, what have I done? I've just replied to somebody. I want to send this to everyone in the meeting. Apologies if I've just sent you a link as a personal message rather than a private one. And there we go. So that kind of thing I think would be really useful in terms of office function. Split keyboards are brilliant. Keyboard, like laptop screen or height adjustable screen raisers are also really good. So what you don't want is to be looking down while you're typing. What you want is to be looking straight and for your eye line to be in like the middle of the screen. So mine's actually a bit low at present. So I probably need to kind of adjust that. But yeah, hopefully that is a little bit of useful advice. But Posturite are going to be the right people to come and visit, assess, try out all this equipment, recommend some things that will really give you a fantastic working space that does support all of your needs. The other thing I think might be useful would be a referral to pain clinic. So if anti-inflammatories aren't an option, and I wonder whether anti-inflammatories in general aren't an option or whether anti-inflammatory tablets aren't an option. So you may find that you can get away with topical anti-inflammatories because it's not actually having to pass through your stomach and part of your digestive system. So that might be an option, but just to have a look at pain management options, medication options that are basically going to work with your, with your needs. So I would recommend a referral to pain management as well, just to see how that goes. But hopefully that's helpful. I have completely lost track of where I was. Let's try this again. I feel like, okay, following up from the last one, I feel like I'm losing my life. I can't walk very far and have recently been diagnosed with greater trochanteric pain syndrome and ischial bursitis. I have had a cortisone injection and Botox in my jaw and temples for my TMJ. I'm scared that I'm going to lose my ability to walk without hip pain. I'm so sorry. That's really hard. Again, I would strongly recommend a referral to NHS orthotics. So I have had a very, very long personal struggle with very similar hip problems. One thing I would say is a TENS machine is excellent pain relief. Your cortisone injection should have been, I don't know if you got this advice with it, but it should have been followed by like 3 days of total rest. And then you're supposed to pair it with a really intensive physiotherapy routine. All too often, this doesn't happen, and people just give out cortisone injections without any kind of rehab to back it up. So if you haven't seen a physiotherapist already, please see one. And definitely referral to pain management is going to be really important. It may be that mobility aids are useful for flare-ups and in the short term while you're getting that under control. But I think, again, custom-made compression garments are going to be really, really useful for you. just as a way to support your joints, a way to increase that stability and to give you some hopeful pain relief while you're moving around. Yeah, I hope that's useful. Please let me know in the chat if that's useful or not useful, or if you've got follow-up questions. But definitely what you might like to do is basically like write all of this up and email it to your GP and just say, look, I'm updating you on everything that's going on in my life. And then I'm going to book an appointment in 2 weeks. And in 2 weeks, you book an appointment and you say, have you read the letter? That's what I want to talk about. And hopefully it will have given them time to come up with a bit of a plan that will allow you to maybe get some referrals to pain management and to orthotics. And then hopefully you can get sorted with splints with pain management options. TENS machine would be an excellent one to start with. So TENS is transcutaneous electrical nerve stimulation or something like that. Basically what you do is put little sticky electrodes either side of the bit of you that hurts. And it works on the theory that your body can only process so much sensory information at once. Like we don't have the bandwidth to feel all of the things. We can sort of use that to cheat with chronic pain because certain types of sensory input are given a higher priority than pain. So if we can give some of that constant sensory input that's like high priority pleasant sensations, like tingly or rubby or massagey kind of sensations, in the same way that if you like rub an elbow that hurts when you hit it on the side of a door or something, that's using that body's inbuilt prioritization to override pain with a more pleasant sensation. And TENS does the same thing. So what you'll feel is the kind of tingly sensation, but it limits your ability to also perceive pain because pain is a low priority thing. There just happens to be quite a lot of it sometimes. So TENS is something you can generally just buy online. I think the only what's the word I'm looking for? Only reasons why you can't use it. There's a word for that, but I can't remember what it is. But the reasons why you can't use TENS would be if you have really severe unstable epilepsy, if you are currently undergoing cancer treatment, or if you currently have any metal external fixations in the area that you're trying to treat. Almost everyone else, I think, is safe to use TENS. But if you're in any doubt whatsoever, please check with a GP or a pharmacist. But yeah, TENS you can buy online. TENS Care is a brilliant website, and you can just get those and try them out. Yeah, hopefully that helps. Let me know if that's helpful, please. Okay, do I have any suggestions for a support for ribs? Constantly subluxating. Oh, it's done that thing where it jumps around again. Hang on. Constantly subluxing just now, sore breathing, struggling, especially sitting. Only found relief with heat so far. Compression is probably your best bet there. The difficulty with ribs is that we can't really immobilize them because if you immobilize your rib cage, you also can't breathe, which is a problem for fairly obvious reasons. So with rib injuries, physiotherapy is going to be a really good bet, but actually it's not just a case of getting stronger. It's a case of checking you're actually using even vaguely the right muscle groups for things like sitting. So an awful, really scarily high percentage of hypermobile people use the wrong muscle groups for things, don't breathe very effectively, and have terrible posture. We just do. But actually learning to have good posture is quite difficult. And whenever I talk about posture at conferences, you can see the entire audience sit up and fidget. And I've just realized I'm doing that too. But yes, so actually it's going to be a longer term approach in terms of like building that strength, but also looking at how you're breathing, which muscle groups you're using, what's your posture like, what's your seating like, all of that. So actually the thing that finally got me over some serious rib instability was playing wheelchair basketball, because the action of self-propelling was exactly the right exercise that I needed. But obviously that's kind of a niche backup plan. But yeah, physio, if you haven't done it before, I would definitely check out some breath work tutorials to have a look at like your breathing. If you can get an appointment with somebody that does breath work, even better. And I would also check out the wonderful Jeannie DeBon and her Zebra Club. Jeannie has done an awful lot of work around hypermobile people sitting posture, breathing, rib function, all that kind of stuff, because it's all very much interlinked. And if you tend to have a weakness in one of those areas, we tend to be like overlapping little issues rather than just having like one wonky rib. You'll have a wonky rib, but you'll also have maybe a postural issue, and you'll also have like a muscle patterning issue, and you'll also have a breathing issue. So if you can improve some of those, hopefully like overall your symptoms should reduce. So yeah, but support wise, it's very, very difficult. The only other thing that can sometimes be useful would be a corset, but I would caution you that needs to be properly fitted, bespoke, made for you, or at least bought off the shelf to match your measurements very exactly. Any old like off the shelf fashion corset type thing is not going to do the job, and you do risk doing more harm than good. So if use with caution, but I would strongly suggest kinesiology tape as well, and also TENS machines for rib pain can be really useful. So if you've got a local physiotherapy place or you're seeing a physiotherapist, ask if they can do some postural taping to see if they can improve your posture with support tape, because it may be a case of just retraining your body to learn how it's supposed to function. And actually ribs have a tendency to just, if your posture is a little bit off, will wander out fairly easily for hypermobile people. So improving that posture is a really important part of improving that function, but it's also probably the hardest part. So get proactive and, you know, get yourself strapped up there and see how it goes. Okay, I have had a year of physiotherapy for my shoulder and strengthening ankles and wrists to no avail. I've now been referred for 12 weeks of hydrotherapy. What will happen there? Will it be like physiotherapy in the water? Pretty much, yeah, physiotherapy in the water. So hydrotherapy, it looks at the benefits of hydrotherapy over physiotherapy for starters. The first one is that water is really, really supportive. So what it kind of does is give you like water pressure compression. And also because you're floating, you're not having to fight against your own body weight. So you're often better supported and it's less impact doing water-based exercise. The other benefit of water-based exercise is that the same thing that makes it supportive also adds resistance. So it's a really high resistance, low impact, but also very well compressy, supporty kind of exercise, which works really, really well for people like us. The only concern for some people is that hydrotherapy pools tend to be quite warm. So if you have POTS and heat intolerance, be very careful getting in and out of the pool, and take a drink with you. And don't just get out straight of the pool and then walk away. Get out, sit on the edge for a little bit, have a drink, lay down for a bit, then get up and walk to the changing room. But yeah, basically you'll be guided through a series of exercises aimed at using that resistance and that support to improve your function, but without the same level of injury you're presumably getting doing regular physio. So yeah, it will just be, yeah, you and a physiotherapist in a swimming pool doing a little bit of resistance work, really. It's quite a good one. A lot of the exercises they'll give you are the sort of thing that you could replicate in a swimming pool if you wanted to continue that after you found it beneficial. It does irritate. I can see why, but it irritates me a little bit that you're limited to like 12 sessions of something, because if it's really fantastic, why can't you have like a year of it and then you never need to go again? But yeah, so fingers crossed, that'll be a really good one. But hydrotherapy, I genuinely, I really wish the NHS did more of it. So congrats. Good luck with that. I hope it goes really well. Yeah. Are barefoot shoes beneficial for people with EDS? I have pain, tightness in my feet, but don't want to make anything worse. That very much depends on the feet in question. I find walking barefoot super useful for building ankle strength. However, people who've got very, very collapsy arches or very kind of inflamed joints in their feet or very unstable ankles may find walking barefoot actively damaging. So that's not the sort of thing that I can just give you a blanket answer for, unfortunately. What I would suggest would be seeing a podiatrist, actually, and just getting them to have a look at your feet, look at your movement, look at your walking, and seeing whether they think it would be appropriate. If that's not an option, because it isn't always, what I would say is see if you can get a pair secondhand, or see how you feel walking barefoot in general, but don't do very much of it for starters. So do a little bit if you're not used to being barefoot. I mean, I spend half the summer barefoot, so I know that it works for me at this present moment in time. But if you haven't done a lot of it before, do a little bit and see how it goes. And if you find that being barefoot in general works very, very well for you, try barefoot shoes for a little bit, but try them like around the house for an hour. Build up over the course of 2 weeks to around the house for 3 hours. Once you can do that, go for a very short walk out of the house and try that. Jumping into any kind of big change in terms of function, clothing, shoes, behavior, etc., generally speaking, has a tendency to not go well for bendy people. So ease yourself in very gently and see how it goes. You may find you can pick up barefoot shoes on places like Vinted, like secondhand or eBay, or like last season's colors of whatever shoe is available. And if you don't get on with it, maybe you can go and sell the shoes, try something different. But yeah, slow and steady, give it a go, see how you get on. Trust your own body. If you're doing it and you're walking around and you feel like this is not good for you, listen to those instincts, because often we're very much on the money in terms of understanding how our bodies work instinctively. So yeah, good luck with that. See how it goes. Okay, we've got 3 minutes left. Let's cram one more question in. Can I get night resting splints for my hands? Yes, those are a thing. Again, available via NHS orthotics or via hand therapy. You can buy them online, but I would be a little bit leery of some of the ones that look good but are like 20 quid. The ones I got from orthotics when I had a look online for my night resting ankle splints were like 70, 80 quid. Orthotics didn't bat an eyelid at paying that, but I certainly would have hesitated if I was buying them myself. So yeah, if at all possible, see an orthotist or a hand therapist. And if that's not an option, then have a look online or see somebody privately and see how that goes. But yeah, if you can, see an orthotist. But yes, those are a thing, and they are quite sensible if you are prone to losing track of the bones in your hands and wrists while you're asleep. Okie dokie. Please ignore if you've covered this. Any advice for how I can get help on the NHS in London? I can't get any NHS support for hypermobile EDS or MCAS. My regional NHS... Oh, it's done that flicky thing again. My regional NHS area tell me MCAS doesn't exist, according to NICE. Wonderful. So they don't have to fund it, and the EDS is just about seeing a rheumatologist for diagnosis. This ignores chronic fatigue, pain, etc. RNOH has refused me for 10 years. UCH told me to come back in 15 years as there's no research or treatment. Wonderful. UCLH has a hypermobility department. Like, they've got a whole rheumatology clinic specifically for hypermobility. I am gobsmacked that you've not been able to access it. Yeah, that would be my advice there. RNOH as well are normally very, very good. So I'm not quite sure what's going on there. The other thing, I guess, would be to have a look at seeing if you can get referrals to look at symptom management. So rather than go to an NHS clinic, go to like a pain clinic or go for fatigue management advice with an occupational therapist. That would be maybe the good way to go about it. But I don't really know why that's the case, because it shouldn't be, because London is probably the best catered for area in the UK for dealing with all of those conditions. Yeah, I genuinely don't know what to say to that, I'm afraid. The only other thing I will say is, could you, when you speak to like a GP or somebody, if you're asking about referrals, remember the phrase, could you please document that you've refused my request? It's a very nice way of getting like healthcare professionals to recognize that they're accountable for you not getting treatment. But yeah, I really am gobsmacked at that. I don't know why that's an issue. Puzzled. It's difficult, I think, but a lot of these things, getting a diagnosis, great, fine. But a lot of it, the clinical treatment is not necessarily diagnosis dependent. So, like looking at MCAS, treatment is antihistamines as a frontline approach. Any GP can prescribe antihistamines. If you are not getting the effect you need from regular antihistamines, then you go to an allergy clinic. So maybe, I don't know, maybe it might be worth arguing more for like, let's forget about the diagnostic stuff to start with, and let's go with, I need treatment for these symptoms and these issues. Regardless of the cause, I need to see somebody who's an expert in managing X, Y, Z, and go from there. But yeah, I don't know what to say to that. That feels like a bit of a non-answer from me. So I'm sorry. But yeah, best of luck with that. We do have quite a lot of questions left, but I have run out of time and I am very tired and sweaty because it's too hot in here. So what I would recommend is I will brain fog words. We'll write down all the questions, and in next month's live stream, I will pick up the questions from this one that we didn't get around to answering. So please do come again next time. If you found this useful, it would be amazing if you could leave some feedback. There is a feedback form in the thing, chat, words again. There's a feedback form in the chat. Thank you all really very much for coming, because this is probably the busiest one I've had when I haven't had a guest for a while. These do happen every month. Please come back next time. I do sometimes have special guests from various areas with me. So, you know, if there's a specialty you'd like to hear from, maybe pop that on the feedback form as well, just so we can work on bullying somebody from our medical advisory board into joining me. But yeah, hopefully this has been really useful, and thank you all very much for coming, and I will hopefully hear from you next month. Enjoy your evenings, everyone. Take care. Bye.